How should I exercise my device so I get the most out of my implant? The worst thing a patient can do is just ignore it. What's up, guys? Dr. Alex Tatem here, and welcome back to episode 6 of Hard Facts. This is our dedicated series focusing on ED, penile implants, and all other things related to the penis. Today, we're answering one of the most common questions that we get in our clinic, which is how should I exercise my device so I get the most out of my implant? But before we get into it, you know the drill. Hit that like button, subscribe, and hit the notification bell so you never miss a future episode. We're uploading new science-based content almost daily about men's health, performance enhancement, and how to optimize your sexual function and overall life as a guy. So let's talk exercise after implant placement. The best way to think about this is like physical therapy. Anytime an orthopedic surgeon replaces a hip, knee, or reattaches a torn tendon, the worst thing a patient can do is just ignore it. Without physical therapy, without exercise, that joint will freeze up and patients risk ending up right back where they started. That exact same concept applies in penile implant surgery. When a man develops ED or impotence, his penis begins to scar and contract. This is why men will progressively lose both length and girth off of their penis with time. When we place an implant though, those cylinders stop that progressive loss because the body forms a protective capsule around them. We may not be able to regain what a man had in his 20s, but we can still protect what he's got. Still, as men, we want to regain as much length and girth as possible. And how do we do that? We have to engage in physical therapy and exercise to stretch that previously contracted tissue as much as possible. So what does that look like? Well, fortunately, I never go far without my handy dandy implant model. So these are the cylinders that we place inside the penis. What we want you to do as soon as your surgeon clears you, and for our patients that's usually 3 weeks with some exceptions, is to maximally inflate your device. That means squeezing the pump to the point that you physically cannot squeeze the pump anymore. Use 2 thumbs like a bicycle pump if you need to. Your penis should be a little sore at this point, and that's good. It means that you're putting pressure on those contracted tissues and you're doing it right. Then, once you're maximally inflated, grasp your penis with 2 hands, with your thumbs and forefingers at the base and your whole hand at the top. Then, you need to slowly crank the penis to one side for a full count of 10 seconds, gradually putting more and more pressure as time goes on. Again, much like physical therapy following orthopedic surgery, this will be uncomfortable, and that's okay. It means you're doing it right. When you're done squeezing in one direction, then do the same thing in the opposite direction. Then up and then down, and I like for guys to go around the world in each direction at least 3 times. Now, once you're done, go back and try to pump your device again. Each extra pump that you get is an extra 2.5 cubic centimeters of length and girth that you didn't have to begin with. Again, use 2 thumbs. Once your device is max inflated, then repeat the entire stretching cycle again. Your goal should be to do that for at least 5 cycles, putting extra pumps into your device between each cycle. If you do this for every day for the first 6 months of implant placement, you will grow in both length and girth. Not only that, but men with Peyronie's disease will get straighter, and every guy will get more comfortable and confident when using their implant for sex. As my dad used to say, the more you sweat in training, the less you bleed in battle. And as far as a man getting a penile implant, stretching your device is your training. Also, if sex is the main event, how can you ever expect to knock it out of the park if you haven't practiced ahead of time? So, invest in your exercise, your physical therapy, your recovery, and it will pay you dividends on the back end. All right, if you found this helpful, please like, comment, subscribe, and hit the notification bell for when we drop our next episode. And if you want to come visit us to see if you're a candidate for the implant, check out the links in the description down below. Until next time, this is Dr. Alex Tatem, signing off.